Since 1994, the Peter M. Winter Institute for Simulation, Education, and Research has been helping define simulation education in the medical world. In the early 1990s, Dr. Peter Winter, as chairman of the Department of Anesthesiology and Critical Care Medicine at the University of Pittsburgh, realized the importance of establishing a simulation center for training department personnel. The center, which initially was just a couple rooms on the third floor of Pittsburgh's Montefiore Hospital, has grown into a state-of-the-art simulation center where 11,737 UPMC physicians, nurses, paramedics, and other healthcare professionals are trained every year. Innovative approaches to learning are the central focus of all activities at WISER, which occupies 10,000 square feet of space at McKee Place, a short walk from UPMC's flagship campus in the Oakland section of Pittsburgh. Learning opportunities are interactive. Classrooms have computers, so students can answer questions immediately. Instructors can then determine how many students comprehend the information. This technology has important relevance in today's world. In a class on bioterrorism, an instructor might ask, what is the correct dosage of atropine in initial treatment for exposure to sarin, a nerve gas? If there are a few correct responses, the instructor can review the information or perhaps adjust his or her teaching style or techniques. Many WISER educational exercises also are videotaped for further discussion or electronically shared with other sites as part of a long-distance learning activity.
WISER has been around since essentially the beginning of the medical simulation movement in the mid-90s, and our focus has always been on patient safety and still remains today. It is a cornerstone of how we make decisions on our operations and how we design our educational programs. Secondarily, WISER is a concept. The notion that we take simulation experts and instructional design folks along with graphic artists and combine them and pair them with subject matter experts so that subject matter experts don't have to become simulation experts. It allows for us to produce many, many more programs, hence our catalog reaching almost 100 programs as it is today. Recently, we've expanded our operations and created 4 satellite centers across UPMC. This has been in response to the increased need for simulation efforts across our 19-hospital system. We've expanded the role a little bit and are looking at ways to address the efficiency of healthcare operations through standardization of nursing practices, nursing orientations, physicians entering into practice. We've been able to create a safer and more efficient healthcare system here at UPMC.
With the current political and social environment putting the focus on skyrocketing healthcare costs, simulation training can play an enormous role in promoting better patient safety and more efficient, standardized operating procedures, thereby reducing costly mistakes and malpractice incidents. WISER also teaches proper safety techniques to follow when using advanced technology, such as surgical lasers. Fire prevention is a priority in oxygen-rich environments, such as operating rooms. WISER instructors show their students how to prevent a fire and what to do if it does happen. Breakdown in communications are responsible for many of the mistakes and accidents that happen in the hospital environment. WISER's Crisis Team Training course is addressing this by teaching effective, standardized team training in a variety of simulated crisis events. We believe that simulation training is a tool that can help alter the culture of medicine. It could move the culture closer to the goal of never having a patient harmed through interactions with a medical facility. WISER currently offers 120 courses covering a wide range of medical disciplines and skills, including airway management, central venous cannulation, advanced cardiac life support, fiber optic bronchoscopy, anesthesia for liver transplantation, back injury prevention for healthcare professionals, pediatric critical care, obstetrics, emergency care, and respiratory therapy, to name a few.
So my name is Charlie Madeira. I'm a fourth-year medical student, and in terms of this course, pretty much everyone in our class takes it because the simulation that we do here is so valuable. It's one thing to have a class and have somebody tell you what the protocol is, but before you go and do it and really experience it, you're going to miss a lot of things and not really know even some of the basic things you'll probably miss. And it's really benefited me. I'm going into medicine, and I know, and maybe in critical care, and I think it's already given me a head start on a lot of other people who probably didn't have this type of training.
Okay, I'm Mira. I'm also a fourth-year med student, and I really like this course. Coming here, like you can read in the book, like first check the airway, then check breathing and circulation and a pulse. But until you do it a bunch of times and realize that you forgot one time, it just seems obvious until you actually do it, and you're like, oh wow. And then when we go to real codes, it becomes automatic. You're like, why aren't they doing this already? And you see sort of the chaos because you have what to do already in the back of your mind. It becomes automatic instead of having to stop and think through all the things you're supposed to do.
Hi, I'm Kristen Parton. I'm a fourth-year medical student as well. I took this course because I wanted to be prepared if a code happened, because immediately a lot of times we're thrown into it as an intern and we've never had any practice. And I'd rather practice on a simulation situation than a real patient and have them die in front of me when it was something that I could have done that was preventable. As I've heard from a lot of my friends who've entered residencies, they say that this course is irreplaceable, and that compared to other residents from other institutions, they're able to run a code without difficulty, despite all the chaos and everything else that's going on, and they feel that they've been able to save patient lives because of this.
Hi, I'm Jen Thornton, and my role is a little different. I'm a nurse practitioner student, and the simulation lab for me is very valuable in my training. Having the experience of being at the bedside for years, this is a whole different role. So having to be here and actually be responsible for not just doing the things, but calling the shots and knowing what to do and how they're playing out is very valuable to me. And I think the first time I want to see something, I want it to be here in the simulation lab where I can work through the scenarios and remember the effects of what I do and how they'll play out in clinical practice.
For more information on this or any other simulation topic, please visit us at www.wiser.pitt.edu.